Just a minute more to go. I think it's time. Good morning, good afternoon, good evening. Namaste, namaskar, pranam, adab, sat sri akal, vanakkam. Hi friends. Welcome to yet another session of the live chat. And today we have a very, very important topic called sex, different strokes for different folks. And we have two very esteemed guests with us, who are not just guests, but actually they are also the hosts. They are part of our admin team. Dr. Kaushiki Dwivedee and Anupama Garg. So before I introduce the subject and the guest, let me call upon Dr. Manpreet Khemka to tell you about the rules for the day today. That how to ask a question, how to put your queries on the chat and Zoom or on the Facebook. So Dr. Manpreet, please explain it to the audience.
Thank you, Dr. Sanjay. So most of us are aware of the rules. We have been doing it for last few weeks. Just a recap. So please turn your mics, the audio and the video part off when Dr. Sanjay and the experts are proceeding forward with the discussion. That will just help us avoid any distractions and any disturbance. So towards the end, we'll be taking questions, and you can either post your questions on the Zoom chat or the Facebook chat. We'll be taking it in that order. We'll first take the Zoom chat questions, and then we'll be going to the Facebook chat questions. Towards the end, you can also ask the questions directly to the experts. Just raise your hands, and we will unmute you. You can directly ask your questions. So if for time constraints, we are unable to answer the questions, then you can just post it or either send it to us anonymously, and the experts can answer those questions on the Facebook group. So that's about the rules. Back to you, Dr. Sanjay.
Thank you. So Dr. Kaushiki is a board-certified gynecologist and obstetrician from Indian, British, and Australian College of Obstetrics and Gynecology, and has an infertility with 22 years of experience working in this field. I personally know her from, she was an ex-colleague at Max. She's actually a wonderful doctor. She has worked in the National Health Services in UK and in Australian healthcare system. She is also a researcher and has publication in the peer-reviewed journal. Besides being a good gynecologist and human being, she's also a fitness and art enthusiast. You must have already seen that side of her. So Dr. Kaushiki, welcome to the show.
Thanks, Dr. Sanjay.
Anupama Garg is a researcher and she's an author of 3 non-fiction books on alternative sexuality with a pseudonym. She has 15 years of experiential and observational research in the alternative sexuality space. She's a renowned speaker in the alternative sexuality space. She writes wonderfully. She's a good human being. She sings very, very well. And she has writings both English as well as Hindi. And you already know her. She's been conducting the writing workshop, The Right Attitude on the group. So Anupama, welcome today as a guest, not as a host.
Thank you, Dr. Dhawan.
So why talk about sex? Once we put up this thing, there are a lot of questions and a lot of eyebrows raised on the group that why talk about sex? Sex is a very, very important part of our life, of our physiology, of our anatomy, of our psyche. And in a way, sex makes the world go round. Sex is a beautiful act given to us, not just humans, but all the animal species, And it's a very reverent act. It's a reward. It's an incentive given to us to make this world go round, to keep life going on, to make the world going on. So then why shy away from this important subject? It's a subject to be talked about. Is this part. Sex plays a very, very important role in our lives, and it also has both positive and negative influence on us. And India especially is a country which at one point of time was very, very emancipated when it came to sex. No? We have got a full, whole text, the Kama Sutra there. We have temples which are showing, illustrating the act in a beautiful way on the murals on the wall. And to your surprise, we also worship this act. We worship Shivling, which is symbolic of this act, which is basically the beginning of life, the genesis of life. If it's something so beautiful and so important in life, then why not talk about that? Because by not talking about that, by suppressing it, we are propagating some myths, some misbeliefs, some complexes, and some difficulties. So all the difficulties that we experience in our life or we see happening in others' life because of sex is because we don't talk about it. We don't discuss this thing. So we do need to talk about this subject objectively and openly. That is the purpose of today's session on this subject. So once again, I welcome the guests, and let us start with the very, very first question on the subject. So this question I'll be addressing to both the speakers now. Why, according to you, is it important to talk about sex openly and objectively? Starting with Kaushiki.
Right. Being a doctor, for me, all the systems in the body, be it central nervous system, be it your respiratory system, be it your cardiac system, or be it your genitourinary system, which includes genitals and sex and everything, they are of equal importance. Because if, suppose a person has got headache, one knows that it is not normal to have headache. So you have headache, you know what is normal and what is not normal, then you can ask for help, you can seek help. Likewise, you have breathing difficulty or some problem which you know is not normal, you can seek help. But with sex, as we don't talk about it, we don't know what is normal and what is not normal. And that is why our communication about sex related and genital organ related issues are very limited. So to better our communication, be it with our romantic partner to express our desires or whatever expectations are, if in case we have got any problem in the organ, to tell it to our doctor, or if we have to say we are grown-up adults and we have got children who need to understand what sex is about, because today's generation wants to know, in that case, how can we explain them when we ourselves don't know what sex is about? So for me, it is all about empowering ourselves. It is all about knowledge. And as sex is normal, we do need to talk about it. Because as of now, we just assume that it is our instinct. And by our instinct, we should be just knowing about sex and there should not be any education. So that is my take
in
on
other
it.
words, it's important to talk about it because, it's an important part of our healthy body, mind,
Yeah.
and functioning.
Yes.
It is important, a very healthy part of our relationship with people. That's again, so it's important to know about it and talk about it. Anupama, what is your views on that?
Dr. Dhawan, my point of view is going to come more from the social sciences point of view and also how we interact with people. I think it's important to talk about sex because, and this, I'll just use this quick anecdote to exemplify. When I first wrote my books and went back home and told my father that, these are the books that I've written, and my dad's question was, sex ke baare mein kyun likhna hai? And I was like, would you be okay if I wrote about politics? And he said, yes. And I said, would you be okay if I wrote about religion or geography or say, for that matter, statistics, like a subject that we do not use on a day-to-day basis? He said, yes. And I said, but you have an intimate relationship with your wife. Your children will have an intimate relationship with their partner or partners, depending on what lifestyles they choose. And do you still think sex is not important to be talked about? Or are you hoping for the world to be in asexual marriages where sex is just about procreation and not about desire or not about intimacy or not about, say, pleasure? But I think where I want to begin this conversation with you and Kaushiki today is on the note that let us keep our minds open for the next 2 hours and 1 hour, 2 hours, whatever time we take, and let us come from a place of sex is the way to express yourself in an intimate dynamic with another human being. And if we can look at it from that point of view, I think a lot of the rest of the questions and the answers will probably, I'm sure this conversation will evolve into something very different.
Yeah,
So
so
it's important to talk because it's a way of self-expression.
yeah, so it's a way of self-expression. It also has a lot of, a role to play in how the society interacts with itself. There's a lot of social dynamics are involved around that because we are social animals, and in a way, sex is a social act because it involves more than one people concerned. No? At what age should the kids be introduced to the subject of sex? Or at what age should sex education start? Kaushik, in your views?
Right. Sex education, it is not that you decide one particular age. Now the child is 10 or 12 or 13 and you just say, okay, kid, come sit and I wish to tell you about sex. This is not the way it should be. Ideally, it should be told in a stepwise manner, which is age appropriate. Now, what I mean by that, uh, parents might be shocked, but despite that, whatever I am saying, that is evidence that babies as young as a few months and toddlers, they derive pleasure by rubbing their genitalia. That is there. That is how nature is. Um, by 5, and they might be doing it even in public. After 5 years of age, they are more conscious and they might not be doing it publicly, but that desire is there. So basically, what the pediatricians and the psychologists say that, like say for example, a 2-year-old should be aware of all the body parts, including the genital parts, so that if there is any problem, one should be able to tell that there is a problem there, there is a pain there, there is a itch there. Somebody who is not yet in school should know that only the parents or a healthcare provider should be touching their genital parts and nobody else. And if anybody else touches it, they should be telling it to their parents. Before the children are 10, they should know what puberty is, what is menstruation. So basically, it is something which needs to be told at every stage of life, and that should come from the parents. And here is why it is important that parents should also be aware what sexuality and sex and normal sex is about, and where they feel that they are intimidated, they should be taking help of a non-judgmental pediatrician who would be able to help them out in explaining it to the children.
Anupama, was your view?
Dr. Dhawan, like Dr. Kaushiki said, that children do express pleasure, children do experience pleasure. Now, my take on this is you should start talking about sex to your children as young as you start talking about families to your children. So if you can talk about a family of mom, dad, and brother and sister, then you can also talk about a mom and a child, a dad and a child, two mothers and a child, two fathers and a child, and automatically the child will have questions. My approach to educating children as a friend, as a secondary caregiver to a lot of children, is I answer their questions when they ask it, and like Dr. Dwivedee also said, in a very age-appropriate manner. So there will be children who will ask you, oh, where did I come from? Or where did you bring Bhaiya from? And then the usual answers is Bhagwan ne de diya, hum hospital se le aaye, and that sort of answers. Now that's when you need to start saying, okay, it came from mummy's belly. And now probably the child will have the next question, or the child may not have the next question. So where do you start? You start when you start telling them, this is your nose, this is your ear. Okay, similarly, this is your vagina, this is your penis. And so that's the first level of education. The functionality can come as they keep growing, and there could be answers where you might want to go back to them and say, you will understand this as your body grows. You will understand this when we go to the doctor. If you don't know what answers to give them, please do not lie to your children. Children are very smart. They know when parents are trying to avoid a question. They know when parents are trying to give them a mishmash answer. So if you don't know the answer, please find a friend, please find a doctor, please find an expert, find the answer, go back to your children. Your children will be able to talk about this in a far more sensitized manner with you trusting you as a parent. So as young as 3, as old as there is no upper limit.
So basically, the idea is that one should start talking about this subject early enough, much earlier than one would think. Why? Because of two reasons. One is that it's required for a normal development of a child. This is a very common thing that a sensory deprivation of any form leads to a maldevelopment or a delayed development. So if we talk about visual stimulation, auditory stimulation, we should also take into account the sexual stimulation. Kids do that themselves. If you don't talk about this, then they may have very funny, weird ideas which they may acquire from various other sources. So for the healthy development of body, psyche, and physiology, it's important to talk about this. Socially also, it's very, very important to talk about this. And now coming to the question of the kids asking the question. Kids are actually very, very smart, much more clever than you imagine them to be. Sometimes they're asking questions not to find the answer, but to test you whether you are being honest to them or not. So when they say, where do the kids come from? And if you tell them they come from the hospital or it's a lottery, that brought you a child, they will know that you are kind of trying to make a fool of them, because they know that kids, this is something to do with the belly of the mother, because they have seen women around getting pregnant. They've seen the baby bulge. So they are smart. So don't. Also, typically, the female child, develops their menarche or adolescence. It starts around the age of 11, 12. For boys, it starts about 13 to 14 years of age. So that is the time where their sexual development actually starts to happen. Their body changes, their mind changes. So they should know about these things well before that. And yes, as Kaushiki said, that sex education of child, it's not a one-time affair. So it's not that you sit once and tell everything in one go. No. It has to be graded. You have to slowly keep adding information. And at home, so the sex education is provided by the families or the parents, and as well as in the school by the teachers. In schools, they have to follow a set time. Okay, fine, at this age, they will start the subject. But at home, you can always modify depending on the curiosity of your child, depending on the maturity of your child. You can introduce this subject. Also, it's important that they should know about this, because this information, this knowledge is also linked to the development of their sexual identity. So that is the next question, that at what age this sexual identity develops and what factors adversely affect that? Kaushiki?
So there are two things. One is gender selection, the gender identity, and one is sexual orientation. So these are two different things which are obviously confused by the people. And I will come to the question, the basic question which you asked, that when it starts. So first, I would like to talk a little bit about what is gender identity and what is sexual orientation. A gender identity is how a child or a person identifies oneself as male, female, or transgender. Transgender means that at the time of the birth, the pediatrician declares that the child is male or female, but the child may feel, that is a part of the sexuality, that they don't fit to their designated sex, like they've been told they are males, but they don't feel it that way. So those are the people who are transgender. And sexual orientation is to whom they feel sexually attracted, which can be heterosexual, which can be homosexual, which can be bisexual, which can be asexual. So these are two different things, but then these things develop simultaneously almost. And again, it will be shocking for many to hear that this process starts as early as 2 years of age, because children are able to differentiate that a boy is a different from a girl. By the age of 3, they are able to decide that, okay, fine, I am a boy and she is a girl. So these kind of things, by the age of 4, they know exactly, they have a gender identity that they are a male or a female. And we do notice by the age of 6, 7, already boys are playing in a group of their own and the girls are playing in a group of their own. So they have identified that who they are. So Basically, it starts as early as that.
Correct, I know. And see, it's important to know that early when the child is born, in infancy or first year of, child is not able to differentiate between self and non-self. So first, this differentiation starts that what is me and what is not me. So my body is me, the environment is not me. The people around me are not me. My parents are not me. My siblings are not me. So me, the self and non-self identity happens first. Once that develops, then looking at others and comparing with others, the second identity comes in, the gender identity, male or female. And also that is, two ways. The one is the realization from within, and secondly, what the child is being told by the parents. So it's very, very important that the communication by the parents, by people around, the signals should be the right one. And so the parents need to know about these things. Anupama, what is your view on the gender identity?
So the age bit you guys have already discussed from a developmental point of view. When it comes to how does one identify themselves, I will only add one generic term to the terms that Kaushiki used, which is queer. So how we look at it in the social sciences context is there are people who identify as the gender that they were born with, as the so for instance, I'm a born biological female who identifies as a woman. So my gender identity and my sexual orientation are, and my sexual orientation is that I'm hetero-flexible, which means I am primarily heterosexual. I might occasionally get attracted to a woman, but that's, that depends on the person. So in that sense, when the interesting thing here, Dr. Dhawan, is that while on one hand, it's very important to understand these different identities, on the other, we need to not fall into the trap of using them as labels, because once we start classifying, then we start focusing more on the differences between human beings and human beings rather than the similarities. So the similarity to notice here is that all children start identifying with their sexual selves at as young as say 2 or 3. The difference is how they identify, but the key factor here is, can you let them evolve into the best person that they can be, and can you let them evolve in a way that doesn't make them feel ashamed about whoever they are. So like you will notice a lot of this upbringing is ladke hote nahi hai. Now, what you're ingraining in the child is that there is a gender, there is a certain sexual orientation which is supposed to behave in a certain way in the social setting, and that social setting will eventually spill over to their intimate dynamic with other people. And because we are not mindful of things as basic as that, which are non-sexual, quote unquote, in nature, but they are impacting people's sexuality, we end up telling girls how to dress a certain way. Pink is for girls and blue is for boys. So I think the way I look at it, gender is biological, but your sexual orientation and your sexual identification is also deeply influenced by your social set of constructs. And the important thing for aware parents is to see that these constructs help the child grow up nicely, but they don't make the child biased or ashamed of who they are. So that's the only thing I want to sort of add to it.
Correct. And second part of the question was that what are the factors which can adversely affect this?
So the factors that can adversely affect this is trying to force a certain sort of identity on children. Like you will see a lot of young boys, for instance, like dressing up as this, they enjoy wearing their sisters' clothes just because it's fun. But what happens is that we are like, अबे तुम लड़की थोड़ी हो, oh मेरी गुड़िया आ गई, and all of that, coaxing, cajoling that we're doing with our children, or when we say to our children, बेटा तुम लड़की हो, तुमको strong होना है so that nobody takes your advantage. And you won't believe me when I say this, like research, when we go and interact with communities offline, we see these conversations happening with girls of as young as 4 and 5, and I understand that a lot of parents are coming from the fact that they want their children to be protected, that they don't want their children to be molested or abused, and all of that happens around in the world, and I understand that. But what that is also doing to your children is it's adversely affecting them. It's making them feel there is something wrong with them being a woman. There's something wrong with them being a young child. There is something wrong with them having a boy's body but feeling like a girl within. And when that starts happening, the children know, अच्छा मेरे को अगर कुछ अलग feel होता है मेरे साथ के लड़कों से तो मुझे जाके parents को नहीं बताने का है, because they are going to judge it. Now, similarly, you will also see a lot of pop culture references, movies, a lot of looking down upon LGBTQ people. And when all of that happens, you as a parent need to be mindful of what your child is getting influenced with. And maybe it's a good idea to have a weekly, like one of the things that I recommend to a lot of fellow parents is that, when I say fellow, I'm talking of my peers who are parents, is that maybe just have like a day a month where you will watch a movie which is at age appropriate, but you will refer to the nuances of gender in it. You will discuss this with your children, and that allows you to nurture them rather than them getting influenced by external, because external judgments are always going to be there, and there's only this much that you can control.
Correct. So the idea is that you should communicate to your kids in a way that not only it helps in their proper development of body, mind, but also, and of course, safety is important, but don't get too obsessed with the safety, because in that process, it should not happen that they get confused, or they get complex in certain forms. So keep a balance of a healthy development and safety in the same point of time. And that can happen when the communication is more open and objective. So open, objective communication is the key to the thing. What should be the parents' attitude towards sex and sexuality with regards to the kids? I mean, we come from a generation where it was said bad, it's a bad thing, and it was never talked about. And these days, things have changed. Even if the parents don't talk about it, kids have got access to all the information on of the world. And kids are seeing those signals, kids are seeing those imageries, kids are seeing those representation on TV, on internet and all. So they are exposed, they have information. So I think that, but it is the parents' attitude which actually decides the psyche of the child. So what should be the parents' attitude?
One thing is that no matter how much your attitude is supportive or non-supportive, one of the things that we need to really, really understand is that eventually all these children are, they have their own agency. They have their own freedom. They will evolve into who they will evolve. Now, the only thing that you can decide for yourself, if your child chooses an alternative expression, if your child chooses the pure expression of their sexuality, the only thing that you probably can decide is, do you want to support them or do you want to be standing against them? There are enough people out there to judge them as it is. That's the bottom line of it. Like, so this takes me back to the conversation where, which I had again with my father. This was years ago, and my brother was in +2. They had only launched the sex education curriculum very, very superficially. And my dad was like, "ये क्या पढ़ाते हैं आजकल के schools में?" And my question to him was, would you rather be in charge of what your children learn and how they grow up? Or would you leave that to the external factors? Like you said, there is enough percolation of information happening. Children today have far more access to not just information, but also misinformation. A lot of porn is available, a lot of myths are available, a lot of pop science is available, and it's very, very easy for a child to feel overwhelmed and confused. The only thing that you can do as a parent is to create a safe space for them where they can come up to you with a piece of information and say, "Oh, you know what? I read this somewhere. Do you think this is right? Do you think this is accurate?" Please do not get entangled with your children into what is good and what is bad and what is right and what is wrong. Please keep it to a very objective, factual discussion. This is healthy. This is not healthy. This is age appropriate. This is not age appropriate. This is good for your body. This is not good for your body. And if you have doubts there is enough good, healthy, proper, accurate information available. So use that to your advantage. And once you start doing that, your children will know that they can come and ask you anything, that they don't have to sort of go back to their friends who are as young as they are. So how do you do that? You, like, there's this friend who has a structure in place. They have an open door policy, but he makes it a point to always knock and enter his son's room. And accordingly, the son always comes back to him whenever he has a question. And that's the agreement that they have made. And they've made it as young as when the son was 7 years old. It works for the father when the son grew brilliantly. My question is, are you willing to make those agreements? And as a parent, you will have to understand, you will have to push your boundaries. You cannot just simply sit in denial and say, "मैं बात नहीं करूँगा, किसी और से बात करवा देता हूँ." There is nobody else who's a parent to your child. So I might sound very harsh to a lot of parents when I say that you have to be accepting, but you don't really have a choice. Your children will still do what they will do.
So, Kaushiki, from you, I mean, Anupama said, okay, what should be the attitude? Have you in your practice noticed that a warped attitude towards sex and sexuality of the parents has had an adverse effect on the minds of kids or how they take sex in their life, you know?
Right. Before I answer this question, I would like to add just one line to what Anupama said. Everything else is all right. You have to accept that what children decides, what their sexual preference is. But it is always a good idea as a because see, every family has got a different value. Every culture has got a different value. So there is no harm in just, though answering the question factually, there is no harm in telling that, look, kid, I think that this is the time when you are studying, say maybe you are in your teens and you are about to go for competitive exams. It's better to focus on your studies. This is more important at the moment, and maybe these things can wait. So just to tell what your sensibilities or what the family moralities or what the culture is. So there is no harm. You're not imposing, but you are just telling the child that this is what would make you happy, because you also have a right to express, because otherwise it will be a dissatisfied community where children is doing whatever they want to do and parents are unhappy about it. So do guide them, but at the same time give them a guideline that this is what is normal in their mind. Now coming to the walk thing, yes.
Sorry, Kaushik, I'll interrupt here. You know, the important thing here there is that, in my view, that if parent has a very mature relationship with the kids, you know, they have established the credibility in the mind of the
Yes.
child. You know,
Yes.
they're more likely to be in the kids are more likely to listen to what you're saying. See, it's not just important to say things. It's not just important to say what your desire, what your morality, and all those things are. What's more important is what kid actually follows in their life, you know, and kids will follow by emulating you. When they see,
Right.
okay, fine, that you are open about things, you're logical about things, and that in the past, whatever you said has been correct, so what you're saying now is also right, they're likely to follow you. And
That's right.
if they don't want to follow you, they'll be open about it. They will communicate with you.
Sure.
Okay, fine, I don't
Yes,
want to
we
follow
will.
you. So that is more important rather than and the child saying, okay, fine, I'll follow you, and behind your back, you're doing whatever you don't want them to do.
Yeah,
So again,
that is why
yeah,
you have to build the
very,
relationship
very
from the very
important to have
beginning.
an open and a very objective communication with kids and establish your credibility also, so
Yes,
that they can actually trust you and open up with you.
that's true. So yeah, and the main question that you asked me, yes, I even now there are not many teenagers or young adults who come seeking help from the gynecologist, but yes, I do get occasionally. Maybe in my Australian practice, I used to get a lot of them, lot of teenage moms and a lot of other teenagers who are not pregnant, but then who had undergone already 6-7 failed relationships by the time they were 17 or 18, had a couple of abortions, were drug abusers. So in our Indian society, the problem is not as grim as I have seen in Western world, because still there is some amount of social support is somewhere there. When the parents notice that children have reached in that kind of a mess, they usually get supportive, and they themselves bring the child that, look, this is what the initial problem of the child was, and that is what she went through, and now she's into drugs, or maybe she has these issues which have adversely affected her. Now she is into abusive relationships, so please help her. So many times in my practice where I have come across where the mother and father both, they have brought their daughters and they usually brief me about the problem, then they leave the room, and then it is me and the young adult or the teenage girl that we talk about it, and we try to talk about it rationally, try to listen to her and to make her feel that I'm on her side. I'm not against her. That is the main feeling, and still I would be guiding her to what is in her best interest.
As an
So
extension of my
yes,
initial question, do you think that the parents' attitudes towards the concept of sex affects the sexual health of the child?
of course it does, because that is what we have been talking so far. That when the parents are very rigid, like if they don't accept that as a child as young as 2 years old can be, masturbating without realizing that the child is masturbating, to them it comes as a shock when they find that a 15-year-old is having sexual desires or is thinking about them. So they just block themselves, and they are not receptive to the children's need. They don't listen what the emotional trauma the child is going through. So in that case, the child has no other option but express it somewhere else, which is an unreliable or an unsafe source, rather than to parent who would be the safest source. So that is why it is important for parents to accept that they need to accept the truth and guide the children accordingly, so that they do not end up in any trap. So yeah, it does.
The sexual desire starts shaping up around puberty, but youngsters don't get married till about late 20s. No. So what are the struggles that they face and how to deal with that?
Right. So here comes the role of sex education. When we say sex education, the thing that flashes in the mind of common people is that, okay, fine. So today the child had sex education class, and they have been taught how to do sex. That is not the idea. It is just to empower the children. They understand what it is actually about, and how to practice safe sexual practices, how not to get teenage pregnancies, how to prevent STIs. So these are the things which sexual education tells us. Now, there was a study which was conducted in USA, and they found that uh, they divided the children or the young adults into three groups. So they said that the people who had, the groups were like up to the age of 17 to 19, and over 19. So those who had sex before 17, they were considered to be underage. Between 17 to 19, they considered it to be normal age. And more than 19, they thought that they started a bit late. So what they found, that those who started early, that is less than 17 years of age, they were more likely to be in abusive relationships, or maybe more prone to substance abuse, maybe to more prone to aggression, depression, etc. The study can be skewed. It can be other way as well, that because these children were more prone to these things, they started sex early as well, and in long run they were the failures. Failures in the sense that they could not do professionally as well, because most of the time when they were supposed to be studying and building their career, they were engulfed in this kind of complex situation. While those who started either in the normal age, which was categorized by that study, or who started later in the age, they were found to be more stable. They were found to make more informed choices. They were better placed professionally in life. So again, what was the difference? The difference was, when they conducted the study, they found that those who started late or a normal age, they had proper guidance, they had sexual education, and they had the maturity to understand that what is good and what is bad for them. So again, the answer to it lies, how to cope with it. The answer to it lies in being open about talking about the sex, for them to understand that it's normal. If they are having sexual desire, they want to mate, it is normal, because that is how the evolution took place, and that is absolutely normal. There's nothing to feel guilty about it. But then there is time for everything. And yeah, so my answer is sex education is the way which will help them.
So Anupam, what is your view that, as I said, that the biologically the children are ready around puberty for sexual exploration, but socially speaking, They get married around in the late 20s, these days, or also 30s,
Yeah.
So there's a huge gap. And this is a time of turmoil and difficulty and the struggle. So what struggle do they face, and what is the advice for them?
So the kinds of struggle that people often face, especially older teens and young adults, and even adults who are around 30. The first thing that I want to highlight here is that um, they are not the only people facing these challenges, because even people who are in their 30s, who might have married, divorced, separated, or might be living in different cities, then their spouses have similar challenges. The question here is, so how do they address them currently? Well, some of them masturbate, some of them go for paid sex, some of them watch porn, some of them read literotica. Different people address their needs differently. Now, what can be done? Are these healthy? They might not be, but they exist. So we can't really deny them. That's one thing. What we can do certainly is help them find better and sustainable ways of creating meaningful relationships with people, where they can have a partner or partners depending on what their choices in life are, and then explore this in a safer manner. So interestingly, from the alternative lifestyles, there is this term that comes around a lot, which is safe, sane, and consensual. Now, when you talk of safe, sane, and consensual, safety can be of multiple kinds. One is the physical, sexual safety, how your organs are. Do you have any STIs? Are you contracting any diseases? Who are you going around with? But there is a lot of emotional safety and a lot of intellectual maturity that also comes into picture. So, what Dr. Kaushiki highlighted, if I was able to understand it properly, was that the more mature you are as an individual, the better it is, the easier it is for you to be able to channelize your desires. That's one. Now, is masturbation abnormal? Well, it's not. The stigma attached to it comes primarily from the fact that we have a judgment about it. It's as normal a bodily function as anything else. So my point here is, what can be suggested? What can be suggested is to help people frame and create sustainable relationships. To help people understand that there is an age appropriatedness to it, there is a legal consequence to doing things. So, for instance, if I am an adult and in the name of educating a child, I end up taking advantage of the child, well, then I am liable to be held under POCSO. So I'm not going to get into too many details of the legal stuff because I'm not an expert there, but I will simply say that if you are an underage child, you shouldn't have sex. I understand you will have urges. I understand you will feel like masturbating. And for parents, please know that your children will go through this. Please don't judge them for this. Please don't shame them for this. Please don't tell them it's wrong. Because if you tell them it's wrong to masturbate, they will do it behind your back, and they will carry that this is wrong throughout their lives. And then there'll be other problems which will be manifesting in their body, which will be manifesting in their self-esteem, which will be manifesting in their connections that they make with people. So that judgment has to be dropped for the parent bit of it. From adult point of view, like people who are already adults, who are 18 plus, who are legally allowed to have sex, my input only is that focus less on the pleasure bit of it, focus more on creating a solid, intimate bond with someone bit of it. Also, relationships, while it may be very it's a very fantasy world where people say अच्छा मुझे प्यार हो गया, मेरा जीवन इसी प्यार के भरोसे चलेगा. It's a very dreamland sort of a situation. So you need to have your careers, your finances, and this is especially applicable to younger adults. Your careers, your finances, your social standing, your stability will help you support and create stable relationships rather than just drifting from one to the other. Paid sex is illegal, so please do not do that. I do not have any moral qualms around it, so I don't care if it's right or wrong. As a researcher, as somebody who studies it, I do not see any qualms as long as it's being done, practiced safely. Consent is very, very important, and that's something that I focus, like I really bang my heads with people on it. If you are with someone who you're not sure wants to have sex with you, or if you are personally in a space where you are not sure if you want to have sex with someone, please err on the side of caution. It's better to not have sex than to have it and regret it later. It's okay to not have sex. It's okay not to give into the peer pressure, because there is a lot of peer pressure and it influences people a lot. At say 30 something, you will see a lot of your friends who are married, you will see a lot of your friends who will be in relationships, and you will feel like, oh, what do I do with this now? I'm not asking you to deny your pleasures. Like, I'm not asking these adults to deny their desires. I'm simply asking them to be a little patient and a little gentle with themselves also when it comes to sexuality. If we can show ourselves gentleness in all the other aspects of life, why not in this as well? So the suggestions are: create stable relationships, talk openly, find frameworks that work for you, and if you want to self pleasure, please by all means. I mean, there's nothing wrong with it.
So it's
I'd rather
important.
have you do that than get into a relationship just for the heck of it.
So it's very, very important for the society and at least for the parents to realize that, say, when we address our children's emotional needs, their food, their clothing, their educational needs, their other aspirations and all, we should also keep in mind that after a certain age, sexual needs also start and they manifest, and they trouble the child. And socially, those needs cannot be fulfilled till they get married. So there's a long period of about 10 to 15 years, where there's a lot of turmoil in the mind of the child. We should understand that turmoil. The only way we can help is by talking about things, by being objective about it, by communicating with them and guiding them in the right way. Kids will understand. Kids will understand your point of view if you're open and if you're understanding towards them. Uh, so So, is there any right age for a sexual intercourse? Biologically, we are ready around our puberty and our adolescence. But socially, it said it's 18 or 21, no. But what, according to you, should be the right age when one should say, okay, fine, you need not have it, but if you had it, it's okay. Kaushiki?
So yeah, Kaushiki, you're on mute.
Yeah, okay. Anupama, when do you start? Okay.
Okay, so the way I look at it, I think I will go with the scientific experts in this case, because while you may be ready, your bodies may be ready, your desires and minds may be ready in your minds and the minds of other people, there are implications of sex and there are biological implications of sex. Pregnancy is one of the major ones. And pregnancy is not something that is the responsibility of just the girl or the woman to deal with. It is equally the responsibility of the person who impregnates the woman. So, which is why this is like one question where I just do not debate. There is no scope for me in this debate, because it's not a debate. It's very simple. Please adhere to the biological guidelines. Please adhere to the medical recommendations and the legal age that is there for it. Dr.
Right.
Kaushiki, you can say something.
Yes. So, as you rightly said, that I mean, there is actually no set age which can be said that, okay, fine, now this is the cutoff and you are ready to have sex, and prior to that, you are not ready to have sex. Legally, we know in India it is 18 years for girl and 20 years for the boys. But in India itself, there are certain tribes where it is still a practice, and they have given the children there have been given special right that they can be married by the age of 13. So they get sexually active by the age of 13. So basically, it all depends upon the society in which you are living, what is acceptable. Like in my clinics in UK as well as Australia, I would find a 15-year-old girl who is pregnant and who is coming along with her mother and sometimes boyfriend. Sometimes the boyfriend has already left and there is another new boyfriend who is coming along with her, and that is all acceptable. So that kind of scenario we cannot think of in India. So what will work for one place will not work for another place. So you have to see what is society appropriate, what is family appropriate, what is age appropriate, and obviously, and so actually there is no right or wrong answer for it. But yes, the age of consent, and let me be politically correct, the age of consent is 18 years for girls and 21 years for boys. And there's one more thing, which as a gynecologist, we have to be careful, and it's a serious topic. Suppose a 15-year-old girl comes to us who is sexually active and had a consensual sex with, suppose, her boyfriend who was 17. It is okay. You will try to make them understand that, see what the safe sexual practices are, what they should take care to minimize the effect of STIs, what they should be doing for contraception. But if suppose there is a 15-year-old girl coming with a 25-year-old man, then you have to be really very cautious, because there can be a possibility of sexual abuse there. That angle should not be missed. And that is where is the role of the clinicians or the people who come to know about any such relationship, that one has to prevent sexual abuse. And I have come across innumerable ladies whose behavior I will find very odd, and somewhere in my instinct I know that there is something wrong with their sexual history. Maybe they have been molested as a child, or there is something. And when I talk to them softly, gently, after a couple of sessions, they will come to this, that they were sexually abused at some point of time. So this is an important fact. As far as the age is concerned, one has to take care, and here clinicians can be of great value. So this is all what I have to add over
Coming to the point of sexual abuse, do you think that sexual abuse can be prevented to some extent by openly talking about sexuality, sex in the family, and being objective about things and imparting this information to young children?
Absolutely. That is why in the very beginning I said that when the the child is maybe 3-year, 4-year, 5-year-old, tell them that no one else except for the parents and the clinician to whom the parents have taken the child to should be touching the genitalia. So one should, and that was the whole idea, that the parents should be open to talk to the child about the whatever the sexual information is, which is age appropriate. And if we talk about that, then in that case the child has the confidence to come back to the parents and tell whatever they have gone through. I will tell you my personal experience as far as that goes. My parents were very, very conservative. My father was very conservative. My mom is still very conservative, and she's the kinds when in our childhood there used to be chitrahar and there was a kissing scene, and she would say, "Ye kya ganda dikha rahe hain." That was her psychology. Despite that, she told me that, see, if you have even committed a crime, or if you have committed any blunder, or if you have, ended up in anything, just come back and tell to me whatever has happened, because even if you have murdered somebody, I'm going to protect you from there. And I had that kind of confidence that despite that conservative background, I could come and tell her, and even today I can share with her whatever these kind of things are which you cannot talk to anyone. So it is very, very important for the parents to build that kind of confidence that they are there always for the children. So yes, it is very important.
Anupama, your
I am just so it was such a nice experience for both Kaushiki and me to jump. Absolutely, yes. Like we just jumped at it together. And yes, sex education helps a lot of abuse being prevented for two primary reasons. One, when you talk to your children or the children who are in your care, if you're a teacher or if you're a doctor or if you're, another so whatever sort of healthcare, whatever sort of care provider rather for children. Two, there is an interesting point here. Often children fall easy prey to pornographic impressions because लड़कों के बीच में पहले सीढ़ियां घूमती थी, अब सीढ़ियां घूमने की कोई जरूरत नहीं है क्योंकि सब कुछ लाइव स्ट्रीम होता है, so people can actually go and watch it. Kids have more access to internet and data and everything else, and it creates a lot of misconceptions in their head about what intimacy really is. One has to understand that porn, for instance, is a commercially produced venture. It's not how your life is. But if you're not talking to your children, if you're not giving them the space to come and tell you this, then they don't know this. Then they think this is reality and this is how they have to be with girls or with boys. Then girls have to have a certain type of body which has to look like a perfect pornographic model types, and the boys have to perform in a certain fashion in order to be called a dude. Then the whole conversation around the first base, second base, third base, fourth base starts coming up. And to address all those misconceptions, sex education helps a lot. Now the question, however, that the larger community can debate and the academicians and everybody else can ponder upon is, what do we really mean by sex education? Now that is one thing that I am not very convinced with the current curriculum, but sure, experts are doing their best, I'm sure, and we have a lot of problems to solve even before we reach a point where we can open up this conversation like a curriculum war. So I understand that there are going to be frameworks. It helps to answer your question very directly. Education helps in preventing abuse at a lot of levels, both from the victim's side as well as the perpetrator's side. And but the education can actually be successfully imparted only if we start creating an environment where communication starts happening.
You said something very, very important, which is missed very, very often, is that you said that the abuse can be prevented from the perpetrator's side by talking about sex and sex education. That is something which our society is completely missing on. The parents miss on that. It's not only important to talk to kids about healthy sexuality to prevent their abuse, but also to prevent them from becoming abuser later in life. And so that's a very, very important point that you pointed out. Coming to the next thing, that what are the important differences in sexual behavior of a male and a female, and why is it important to know those differences?
Right. So is it directed to me?
Both, one by one.
Right. I mean, there is no way of entering a male's mind or a female's mind to tell that, okay, fine, this is what a male wants and this is what a female wants. But I would try to answer your question again based on evidence. There is this theory of evolution, which we all know, of Darwin's theory. And based on that, before I talk about the male and female behavior, I would like to tell few animal behaviors, and probably that will help in understanding what I'm trying to say. So there is this weaver bird, we all know, and the weaver birds make their own nests, and it is usually the male who makes the nests. So when it is their mating season, so what the male will do is that by singing, he will invite the female to his nest, and then female will have a look of the nest. She will pull the twigs and show whether the nest is strong enough or not. If she finds that it is strong, she will stay, and then they will have mating, and then they will have children. But if in case she finds that it is not up to her satisfaction, where she is not feeling safe enough, she will go on and she will explore, and she will explore the male till she has found a nest which she finds that is good for and safe for her to lay her eggs. At the same time, if a weaver bird has built a nest which has been rejected by several females, the weaver bird will destroy that particular nest and will reconstruct, because he finds that there's something faulty about it and no female is agreeing to it. So this is one example. There's another example, that there is a weird insect who is a scavenger called scorpion fly. So they copulate in a very different manner, in that the complete mating process takes around 20 minutes time. So for that 20 minutes, the male scorpion fly gets a big insect for the female, which he has stolen from the the spider web or somewhere. So it's a big insect which this scorpion fly will give to the female. Now, as the female is busy eating that insect, they have the mating. Now, if the size of the insect is small and it finishes before 20 minutes, she will leave. The female will leave, and the copulation is incomplete, and she will find another male. So what these two examples suggest? It suggests that females in animal kingdom as well, they are looking for a mate who is able to, because they are giving certain premium quality of theirs. They are giving their body. They are giving that for the price of carrying on the genetic material of that particular male. She is giving her body, which will be carrying the progeny for some time. So she is giving the resources for which she needs some cost, and that cost is what? It is the security, safety, and the breadwinner part of the meal that she is looking for. Now, coming to, I will give another example, which is for males. So, we have lost Dr. Sanjay.
No.
Yeah.
Right.
Hi. So, can I carry on?
Yes, yes, please.
Yeah. So then there are elephant seals in California, where it is known that 5% of all male elephant seals mate with the 85% of females in that particular population, and they make a harem sort of a thing. So what they do, these 5% of elephant seal, they are the big ones, the mighty ones. They kill, they bully, and they shun the weaklings away from these females, and not just their harem. They find other females also around. They make them join their harem, and then they have their sexual intercourse. So what is happening, that they're ensuring that they're, and because as they are stronger, they are more potent, they are able to take care of the females better. So these females are also willing to be part of their harem, and then they are able to pass on their genetic material from one generation to another, while the weaklings, they are eliminated. So this is what is actually theory of evolution which states, and the human instinct of having sex. I mean, the romantics would not like it, the female feminists would not like it, what I'm saying, but this, as I said, this is not my personal belief. This is what the science has to say, and this is what the evolution has to say, that the male wants their genetic material to be passed on from one generation to another, while the female is obviously wanting the same thing, but at the same time she wants something in lieu of that, and that is the safety, security in a relationship. And that is why if you look at the matrimonial ads, even for the human beings, you will find that the requisition for the groom is ki padha likha, achhe post pe place. That is what the requisition is. While for a female, this is not what the groom side is looking for. Most of the time they're looking for someone who is beautiful, who is young. So the idea is that she is reproductively more attractive. So this is what male and female wants, if I have been able to explain in the way of what the theory of evolution have to say.
Anupama, what is your ideas on this?
I partially agree with Dr. Kaushiki. I agree in the sense that there is biology to it, certainly. There is evolution to it. There is anthropology to it. That said, uh, the pitfall that I see with any such theories is that we fail to take into account that as a social creature, as a species, we have evolved very, very differently from, say, the bonobo monkeys. They display queer behavior very clearly. In animals, while the lifespan is different, in animals, the way women are educated or not educated, or the way they function, is very, very biological instead of social. So before we get into, say, scientific essentialism, for the lack of a better word, we Dr. Dhawan, just give me 1 second.
Okay.
I'm sorry about this.
Okay.
So what we need to ensure is that while we understand the scientific concepts in their essence, we also ensure that we keep addressing and catering to the evolving social needs, the way the society is changing, and hence how it is impacting people and their sexual behaviors needs to be taken into account rather than just oversimplifying it. So that's the only trap I see. Now, what are the behaviors in particular? Well, if you wanted to look at the mythical behaviors, well, men are supposed to be stronger, men are supposed to earn, men are supposed to be dependable, women are supposed to be emotionally fickle. But we all know that these are generalizations and these are not actually behaviors. So maybe the question that we want to discuss is, what is a comforting expression of sexuality for any person of any gender or any sexual orientation? Maybe that's what we want to examine.
So of course we'll come to that part, but going back to what Kaushiki said, if you why is it important to understand these behaviors? It's important to understand this behavior because of to understand the changes which are happening in society. How people are behaving, how people behave, what are the goods of the society, what are the bads of the society, how to get rid of all the evils from the society and have only a positive direction. So to be able to do that also, we should understand where the evolution is, where the biology is. And actually, if you look at the animal behavior, it's a fact that across the species, the males are programmed to woo the females are programmed to select or reject, And the objective of this is the evolution, that there's a natural selection, and there's an evolution, there's a growth, there's a diversification, so that the quality of species improves. So it's not a cost that the male has to pay to the female, but it's programmed that way in the genetics, in the genes, in the evolutionary process, that the female selects. And again, to shock people, female is the primary sex. Nature had made female as the main individual, as the main sex. So the female is the primary sex. Any body which is developing will directly form a female unless it's diverted away from that by the male hormones. So the male is a support sex. It is secondary sex. So male was basically provided for supporting is a support structure. It's not the main thing. So the main life is female. Having said that, so these animal behaviors it's important to know them to understand our society and the way the society is changing and evolving. So that
I would like to make one point here, because see, that is what the common perception is, that because our society is patriarchal, and that is why male dominate, and from where all this theory is coming. So again, this is a study, not my belief, that there are several tribes in Western Africa where it is the female who is the dominant one and is more better off than the males. And there also they try to study the behavior, and then they thought that maybe they're the women will be monogamous or dominating or whatever, or aggressive one, but they found that the behavior of the women was still the same as they were when they were in the more patriarchal society. So this is just a quote.
So Kaushiki, we will not get into that, because patriarchy, matriarchy are the aberrations of society. This is not how the natural programming has taken place. This is not how the...
Yeah, exactly. That is what.
So, and that is not the subject of today's discussion also. So those are aberrations. We'll address them later on. We are more concerned about knowing that what is the natural program, what is the natural behavior, and how it has been evolving and changing with the times and with the society. So
no. What I said in the context was that when we say that this evolution theory is flawed, because this is how it has been influenced. So that is not what the research found. The research found that even irrespective of who was dominant in the society, male or female, they found that this particular behavior was same in all the society. That is what I was trying to say.
Yeah, so to address that point, both the males and females have got their strengths, and
Yes.
they exhibit those strengths, they exercise those strengths.
Yes.
And it is important to look at that part and not to consider that as domination.
Yes.
Males naturally are physically stronger, more physically powerful, because they was interested in the physical task of, say, weaving the bird, weaving the nest, hunting, lifting the rocks, going around, climbing onto the trees and getting fruit. So that was the task given to them. But female, being the primary sex,
Yes.
was supposed to be controlling the whole everything. So they're very, very strong. They're very, very strong. They actually mentally control everything. They can actually mentally command the males.
Yes.
So if one were to actually use the word domination, then mentally the females dominate, physically the males dominate. But I think the domination is a wrong word to be used. We should say, okay, fine, they both have this strength, and they express themselves in those strengths. They try to make a difference in the environment using those strengths. And they should actually ideally team up. The mental strength of female should team up with the physical strength of a male, and they can form a very good team. But somehow our society and people who want to bring in those change never address it in from that angle. Talking about evolution and changes happening in the society, Anupama, tell us about how things have changed, how the sexuality, which was so far understood in the conventional term, how it has diversified and expanded to include a lot of other things.
So before we get into that question, just one quick point. There is gender, there is sexual orientation, but there is also, like I said, sexual expression. And that sexual expression, however, is different from this combination as well. There is a lot more nuance to it than just heterosexuality and queer dynamics. So, if I had to like quickly give you an insight into how are some forms of sexuality being addressed, one, of course, is the whole queer spectrum, where there are the lesbians and the gays and the transgenders and the bisexuals, and also every other non-straight dynamic that can fall into it. If we were to get into labels, it would get like very jargonish. I don't see the point of it. Then there is asexuality, but then there is also a lot of other form of sexual expression. For instance, there are a lot of people who are into paraphernalia. There are a lot of people who are into BDSM. There are people who practice polyamory, or and I call it polyamory and not polygyny or polygamy, because polygamy is the practice of marrying multiple people, which has there are laws about it. So that's not what we are expressing. We're talking about polyamory, which in case of, especially in case of men, is often misconstrued with philandering, and in case of women, it's often misconstrued with being a slut, so to say, politically incorrect phrases that we use for people. Um, Now, the question is, are these all necessarily biological frameworks? Well, no. But are they sexual frameworks? Yes, because sex is not just about the act. Sex is also about how you express your emotions. Is there a power dynamic between the partners? Is there uh, a lot of other stuff that you are using to accentuate your experience? Or is your sexual expression being carried out outside of the bedroom between you and your partner slash partners? So when we take that into account, then all of this. So what the other point that I want to make is that when we say how are we evolving, one thing that needs to be kept in mind when we discuss alternative sexualities or alternative sexual frameworks is that there is the normal and there is the normative. The normal is what the biology discusses, what the anthropologists talk about, what the scientists discuss. The normative is what we study in social sciences. So the society says it's a norm for a man and a woman to marry. The society says it's a norm for people to not want pain in their sexual activities. The society says it's a norm do not want to get into, you know, all sorts of accentuating experiences, or paraphernalia for that matter was scientifically considered abnormal for some time, and now it's slowly getting into the mainstream. The doctors are talking about it, there are mental health professionals. Sure, we do not see as evolved a community in India, but well, it's fairly mainstream in the sense that it is being talked about. Is it mainstream in the sense that it helps procreation? Well, not necessarily, but there are ways to address that. So that's like a broad overview. The key points to take from it could be, people could talk about care dynamics, people could talk about the whole BDSM spectrum, people could talk about polyamory. These are the three major non-normative frameworks. And then there could be minor frameworks and nuances within these.
How does the, let us say, for want of a better term, how does the LGBTQ plus behavior start?
See, so there is one bit of it which we've already addressed, which is when does the child start identifying with a certain sexual orientation? That is one way to answer this question. The other way to answer this question is more in terms of their curiosity and their exploration. When is it that they want to experiment? When is it that you see the first signs in your child to want to read something outside their syllabus? Like, there is no curriculum for sexuality, unlike so many other things. For instance, sports, there are the mainstream sports and there are the adventure sports. When does your child first drift towards adventure sports? So there is no right answer to this. Different people experience this side of them at different points. Some people never experience this because they are heterosexual, so it never becomes a question of figuring out for them. I, for instance, was a very, very self-identified heterosexual person till almost 30. And then I found a person that I really liked. And I said, okay, I really like her, but she's a woman. So what do I do with it? And then comes the whole second set of misconceptions, which is that if you are queer, it necessarily means that you want to have an intercourse or something similar with the partner from the same gender. Love, so here is where the overlap of sex and love happens. A lot of people identify their queerness in terms of love and not necessarily in terms of sexual expression. And that is something that we often forget when we get into discussions around queerness. We say, okay, अच्छा bisexual है मतलब इसको, क्योंकि by default the term means that bisexual है मतलब इसको female partner भी चाहिए और male partner भी चाहिए. But we forget that sometimes they could be looking only for the comfort that a feminine mind brings. And so, which is why when I talk about sexuality, I talk about it in terms of compatibility, the intellectual compatibility, the physical compatibility, uh, the social compatibility. And if all of that exists, that is when I think great sex happens. Usse pehle tak, sure, it's exploration, it's great.
So I think that from this discussion, what is emerging is that there are three things. There is sex, there is love, and there is reprocreation. And it's
Yeah.
time to dissociate these three into three separate concepts, three separate phenomena. They may be overlap, but there may not be any overlap also. So sex does not always mean reprocreation. Sex and love does not always mean sex. No. So one should be mindful that yes, these are three separate things, and there may or may not be an overlap. And see, the reason is that with the numbers, the population is so big that we started dissociating sex from reproduction long time back when we started talking about contraception. So that was the first time that this dissociation happened, and which has evolved further into these three things now. Okay, Anupama, tell me that are these temporary phases in a person's exploration and experimentation with sexuality, or are these the way of life with them?
Again, it varies. So, for instance, I will take some insights from the BDSM community here. There is an entire range and an entire spectrum of how people practice it. There are people for whom it's just an element of fun. They keep it restricted to their bedrooms. There are, on the other hand, people who are into very, very structured, dominant, submissive dynamics, which they practice outside the bedroom also. There are people who will create social behavioral patterns consensually between each other. There are people who will say, okay, I am so submissive that I want my partner to take charge. And by the way, we're not talking of dysfunctional people here. We are not talking of people who are incapable of otherwise running their lives. We are talking of people who are stable, who are, like I said, safe, sane, and consensual. So these are people who are consenting to doing things together with each other while being fully cognizant of the impact that it will have and while being sane. Now, so is any flavor wrong? Which is, I think the title of the talk really puts it together well. It's different strokes for different folks. There will be people who will, for the lack of a better phrase, want a partner to be sexually compatible as the more important parameter. Are they wrong? No. There are people who will, on the other hand, prefer the mental and the intellectual and the emotional compatibility better. Polyamorous people, for instance, experience shorter relationships at times because they are polyamorous and they are in multiple relationships. So their relationships might actually be May December romances. On the other hand, there are also polyamorous people who are into households which are non-structured, but they have, let's say, somebody who's a solo poly, who is a single person but is dating more than one people, and everybody is in the loop. So I think the question to ask here is it possible to live them as lifestyle choices? Yes, it is. Are the lifestyle choices made for everybody? No, they are not. So that is why they are non-normative choices. But does that make them necessarily wrong? Well, as long as it lies in the spectrum of safety, sanity, and consent, I think it's absolutely fine. And as long as it's ethically practiced. So there's no manipulation happening, there is no abuse happening, there is no conditioning happening. I think we are good with that.
So how does a person discover this about himself or herself, and how should the person share this with the kin, and how should the family respond?
When you say discover this part, you're talking of any sort of non-normative
Yes.
behaviors.
Yeah, yeah.
So how do they discover? Again, I have seen examples where people have discovered it through porn. I have seen examples where people have simply gotten curious. So you are hanging around with friends one of these days, and there's a truth and dare game happening, and something just comes up and you get curious. There are discoveries that are made because someone approaches you. So interestingly, for instance, the discovery for me happened because the person who approached me was interested in me. Before that, I'd never even given it a thought. It just didn't occur to me in my paradigm. So different people will have different triggers, and depending on when they have the trigger, the age is also different. How do they express it to the kin? I can I've usually found that people find it very, very difficult. There is a very strong judgment, for instance, to say against saying that I want to be in love with multiple people. There is a very strong judgment in saying I'm bisexual, because most people will say, oh, you're bisexual. Primarily, तो तू heterosexual है, तेरे को occasionally flavor के लिए कुछ है. But that's not what the other person is saying. So these judgments make it difficult. How can you do it? Well, there is labor involved in it. There is a lot of hard work that goes in it. There are repeated conversations that go into it. There is literature that you can expose your partner or your parents or your siblings to. But the most important thing is to understand that they may not understand you. And this is not a they versus us debate, that people may not understand you. And if they do not understand you, it doesn't mean you have to deny yourself your truth. It simply means there is more work to be done. There are communities, there are support groups, there are, and especially regarding LGBTQ, now that the Section 377 has been repealed and LGBTQ is no longer illegal. So there are support groups and communities and people who talk about it. It's always a good idea to create that solidarity so that you don't feel alone in your journey.
So what are the safety and other concerns in these situations?
I think the primary concern is consent, given the fact that online dating apps and online ways of connecting with people are increasing dime a dozen. The first thing that people need to be, and especially younger adults and older teens, need to be very, very mindful of is um, how much information do you want to share? Consider it no different from offline. You may have met somebody on Tinder, but that doesn't mean that you're going to treat it any differently from a guy that you met at a party. And just like you would want to know the guy that you met at the party, you would also want to know the Tinder date, and you would not just want to jump into it headlong. That's one. The second kind of safety is around precautions, contraceptions, not just contraception, but also barrier precautions, because barrier protection also prevents you from a lot of STIs. And if you have to do something, then might as well find the right sort of resources and then do it. One of the things that I really strongly recommend is finding a close friend that you can confide in and keeping them as your backup call. Because if you're going to date someone or if you're going to hook up with someone, then might as well have someone in the know so that there's someone watching out for you. Another sort of safety practice comes from the consent element of it. One of the things that I very, very strongly, die hardly advocate for is not getting involved with someone under the influence of substance. A lot of times what happens is, especially younger adults, they go out, let's dinner and dine, and the dinner and the wine is happening, and the alcohol is flowing through, and then they end up doing stuff that they don't want to do. Alcohol or any sort of other substance for that matter is not an excuse. Your altered state of mind is your responsibility. You do not get into a relationship or into a casual sexual encounter with someone just because you were under the influence of a substance. That's one. In established relationships, in dynamics that are long term, I think the safety and sanity and consent and everything boils down primarily to consent. You have to understand that just because you're married to someone or just because you've been seeing someone for 5 years doesn't necessarily mean that they have given you a blanket consent to do anything or everything. So there is no blanket consent. You have to clearly understand that there might be things that may be comfortable in the first year of your relationship and may not be as comfortable in the seventh year of your relationship. At times, a lot of consent is manipulated consent. A lot of consent can also be coerced consent. And then there is the whole spectrum of consensual non-consent, but that's like a very, very specific BDSM framework. So for instance, I am saying no, I don't want it, but I mean it. So ये जो लड़की की ना में हाँ छुपी होती है is a very tricky place to be. Please do not assume that. लड़की की ही नहीं, लड़के की भी for that matter. A no means a no means a no, irrespective of the gender that it is coming from. And if you do not know, then it's a no. If you're confused, it's a no. If they seem confused, it's a no. If somebody is trying to convince you to say a yes, it's still a no. So I think that is what it boils down to.
So yes, consent is a very important part, and as you rightly said, that no means no, and also a yes means yes. So before saying any of these two things, you must be very, very clear in your head that what you're saying. You know, if you're saying no, it should mean no. If the other person is saying no, take it as no. If you're saying yes, take it as yes. No, do not
Yeah.
tomorrow take it
So
as
to go back and say, ki, oh, you know what, I said a yes, but I did not mean it. Well, sure, maybe it's possible, but that's a lesson for future. You can't go ballistic on the person because they took your yes as a yes. So which is why I think yes, yes and no both are to be clearly stated in so many words. Maybe is not an answer. If it's a maybe, then don't do it.
Yes, so these days I think it's better to be unromantic about consent part and be more practical and objective and stating as an agreement yes or no clearly rather than assuming things or having the other person assume things. No.
That's one thing, Dr. Dhawan. There's only one thing that I want to add to it. You know, what happens is that saying a no in the middle of an intimate session can become difficult, both for the person who's saying a no and both for and also the person who's listening the no. Because then it can come across as a rejection, then it can come across as a denial. So maybe a good idea is to have these negotiations and these discussions before and after the encounter. That's one. And two, a great tool is to use the red, yellow, green symbolism. So when you say green, that means everything is great, keep going as you're going. But if it's a red, then both people know that this needs to stop. And a red is a very objective way of putting it. It's not like you did something bad, oh, you need to stop. It's just red. It could be something that's triggering from my past. It could be something that's coming from somewhere else. So instead of in the session, maybe a red, yellow, green symbolism works better. Before and after the session, the whole discussion and the negotiation works better.
Yeah, so that's what I said, that make it, let this part be very, very unromantic, practical, and legally sound. Have a clarity beforehand about everything. And, you know, it's better to spell out things as yes or no rather than assuming them. Kaushiki, what are the precautions and care that you would advise as a gynecologist for a situation like this?
Situation like, what are we talking about?
So, sexuality and expanded sexuality, you know.
Right. Basically, as a healthcare professional, we do get lesbian couples, and the general healthcare is more or less the same. It is no way different from what you know, heterosexual female would need. They would need the cervical cancer screening, both the partners, as any other female would need. Internally, the emotions are still the same. They still get periods. They have period problems. So all the other health concerns are still the same. And that needs to be addressed just like one would address any other female. And there I don't find anything different. So yeah, so basically the care remains the same. There's no change in that as a healthcare professional.
Anupama, what are the legal issues involved here? You said that the Article 377 has been abolished, so it's not illegal anymore. But what is the scope of that, and what is the legal issues?
See, so there are, so I'm not a legal expert, and I will begin with a disclaimer that any of the things that I say on this show are not to be taken as a legal or a medical advice or a psychological advice. You need to visit proper healthcare professionals if you need your specific case to be resolved. Now, with that said, there are two things that I want to, like, there's one thing that I want to add to what Kaushiki said. Probably with women, maybe the healthcare doesn't differ much. I am wondering, I have never asked this question before, but I'm wondering how it would be for gay couples, because their mechanism of sexual expression is very different from that of women. So would their anatomy vary? But that's just
Gays like males, they're at increased risk of HIV and HPV infection. So obviously, they need to meet the andrologist and the STI consultants for that. But definitely, they are at increased risk of HPV and HIV as compared to somebody, and that could be maybe related to multiple partners they have rather than just being in a gay relationship. But yes, it is slightly different, but I'm no expert to comment on that. But as far as the females are concerned, well, it is no different. It is still the same. The general healthcare remains the same as for any other female.
thanks. So that brings us back to your question, Dr. Dhawan. What are the legal consequences? While LGBTQ is being an LGBTQ person and expressing your sexuality that way is no more illegal, but gay marriages still do not have a legal status as such. So, and when we don't have a legal status, well, we don't do it. It's as simple as that. So that's one bit of it. The second bit of it is there are a lot of sexual practices which do fall under abnormal sex as defined, and consent is always a tricky space. So my take on the legal element is that it's very very difficult for a layman or a lay person to understand कि मैं क्या करूँगा तो मैं कहाँ मुसीबत में पड़ जाऊँगा. For instance, let's look at sadism and masochism. There are people who enjoy exchanging pain in their lovemaking sessions. Now, if you hit someone, that's cause for criminal case. If there's a damage, you don't have a healthcare provision. You don't know which doctor to go to and say, oh, you know what, we were trying to play with toys and well, something just got stuck up my ass. Now what do I do with that? So because there is no legal framework as such, so automatically there is no healthcare infrastructure which is designed to cater to specific needs either. And which is why it's like as a researcher, what I recommend to people who ask me this question is, please understand for the time being, please be cynical and imagine that you will not have legal support. That's on the cynical side. There are communities, there are lawyers who provide counseling specific to LGBTQ slash BDSM slash everything else, but they are very, very rare. And also, because there is a lot of social stigma, it's recommended that you go easy and that you know, take it slow and steady, because as a community, we are still evolving in that space. So right now, legal frameworks do not as such exist. The only thing that has happened is the repealing of the law, which basically means that a bisexual person will not be penalized for being bisexual, or a homosexual person will not be penalized. But that's what it boils down to.
How should the society respond to this? And how should society accept?
This is like, since I think the society evolves. There was a time when we did not accept love marriages. There was a time when we did not accept LGBTQ. We are slowly reaching that point where we will sort of, even if hesitantly so, but we are gradually, our acceptance levels are changing. If we could be proactive as a society in accepting stuff, it would help. But the proactivity could come only when there are reliable, credible resources to reach out to. Like porn is certainly not going to make you more sensitive. Judging your children about their sexuality or not creating a space where they can come and speak to you is certainly not going to help. Like I saw the thread that you started on the group, and there were a lot of these comments which said, oh, but this is my personal life. Why do I need to bring it out in public? Oh, but why do I need to discuss with my friends? Well, we are not asking you to discuss hardcore, gory details. We are not asking you about the act. We are not asking you what specifically do you do with your partner. So this is not a maje leke chatkare lene wala conversation. This is a conversation where we are saying, be open to talking about it. Be open to saying to someone, hey, you're polyamorous. It works for you. Great. Are you in a fine headspace? Are you feeling comfortable with this space? So be supportive rather than saying, oh, why are you polyamorous? अच्छा तुम्हारे साथ बचपन में कुछ हुआ था? अच्छा तो तुम्हारी लाइफ में कुछ मेस चल रहा है इसलिए you have multiple partners. Now that line of probing, while it may be coming from your curiosity, it's still a judgmental line of probing. So I think how should society respond? A, please be self-aware of yourself when you ask questions. B, when you ask questions, come from a place of support rather than a place of judgment. If you can't support someone actively, like I have friends who do not support the whole research that I do, they are like, kya zarurat hai iski? But the least that they do for me is that they don't question it. They say, okay, you want to do it, it's all right. I don't want to know about it. And it's okay to say that there are boundaries. See, even for recipients, we as researchers and people who practice and practitioners have to also be understanding of one thing, because we are the ones away from the norm. It's our onus to educate. We may like it or we may not like it. So that's for people who want to be away from the norm. If you are a non-normative practitioner of sexuality, please understand that it will be your responsibility to educate your kin. And it can be done in very simple ways. So for instance, if your parents are looking for a marriage partner, you might want to say, मेरे को इसके HIV और HPV records देखने हैं. Now for a lot of people that's a taboo. मेरे sexual health records क्यों देखने हैं, मेरे पे भरोसा नहीं है क्या? अरे बाबा, अगर मुझे तुम्हारा डायबिटीज का पता होना चाहिए तो मुझे तुम्हारे HIV HPV का भी पता होना चाहिए. It's as simple as that. So I think cues like those can be taken and then we can build upon it. It's the same kind of framework that is about age appropriatedness. So once we start doing that, and I think people who are well-read, people who are more exposed to the ideas, have this onus on them to begin this conversation,
So
which people are doing, but
that's
sure.
a very important point, that people who know these things, it's an onus on them to understand it better. And Kaushiki, there I would say that till our medical school, we were always taught that these things are abnormal. You know?
Yes.
So all the LGBTQ plus spectrum, the whole was treated as abnormal, and till some point of time, homosexuality was considered a disease as a part of the disease classification.
Yeah,
Later
we
on,
have read it in the forensic
yeah,
medicine and toxicology books that
yeah.
it is something which is
So later on,
abnormal.
it was
Yes.
removed as a disease thing. So I think it's very, very important for the doctors and medical community to change their attitude and approach to this. And what is your view on this? And what is the current scenario?
Definitely, because see, we have to be open-minded and compassionate. When we talk about being compassionate, we have to understand that the people who are not heterosexual, which is considered to be the normal sexual orientation, if they are not, it is their right. They are not harming anybody, and it is not as if they are doing it deliberately. That is what they feel from inside. They are happy being whatever, homosexual or even asexual for that matter. There is no, I mean, there are people who are asexual. I do come across couples where one partner is asexual. So you cannot hold it against them. You have to be, you know, you have to understand their psyche. You cannot force things on them, and you have to accept them as they are and help them rather than bullying them or separating them from the mainstream. That is not a good idea. Whatever my beliefs are, but that doesn't mean that if a homosexual couple will come to me or a lesbian couple comes to me, I will treat them any different from how I will treat a heterosexual couple. So yes, we should definitely change. And what Anupama was saying about that she would like that kind of attitude where people get HIV testing done or HPV testing done. Interestingly, since last, I mean, I would say last 5-6 years at least, I do get couples who have been in relationship and who then wish to get further with the marriage, and then they come and they get all their STI profiles done, both of them mutually, and they get it clear rather than Janam Patri milane ke bajaye, they get these things fixed, and then they proceed with the marriage. So there's nothing wrong in that, nothing abnormal in that, and all the scientific things should be encouraged by us doctors.
Great. I like to, at this point, call in Manpreet because she's a psychiatrist, and recently there has been change in, not very recently, there's been change in the definitions of these issues, and which I think Manpreet was trying to highlight in the chat also. Manpreet, what do you say that how the psychiatry community has changed their attitude and the definition of these things?
Yeah, I was just referring to, since you mentioned homosexuality, I remember from forensic medicine, we used to study homosexuality, that being a disorder.
Yeah.
From psychiatric standpoint, it's very recent. With the DSM-5, we don't have gender identity disorder anymore. So now they are going with gender non-conformity. If there are psychological issues related to this, then it could be gender dysphoric disorder, where you are addressing the psychological impact of aberrations, little deviations from the normalcy. But yes, it's not part of, that's the kind of evolution at a societal level, maybe political level, where it's more inclusive. And the term disorder has been taken out now in DSM-5.
So now coming to another important aspect, how do, say, same-sex couples form families, you know? And how do their families shape up, and what is their family structure, and how is this family life? Now, Kaushiki, what do you have to say about this?
Right. Again, one has to keep in consideration whatever the legalities are in that particular countries. But then I have come across couples, mostly in Australia, who were my patients. And the option for same-sex couple is either they can go for an adoption, like, because obviously that is one of the easiest way, and there are so many children who are abandoned and there is no one to take care of them. So that can be a good way to start with. Apart for that, what is very common these days is IVF, where, say for example, there is a lesbian couple, and whosoever is the female partner, as they choose to consider that particular female, she donates her egg, and then we take a sperm from a donor, and then the embryo is formed and it is put back in the uterus of the lady who is from whom the ovum was retrieved. Sometimes they go for a different kind of thing, like that the embryo is retrieved for one and the other partners gives her uterus to be used as a surrogate, so that both of them have the feel of having the parenthood. So there are various permutation combinations which can work, and of course they can get children through ART, which is assisted reproductive technology. And it is heartening to see that how during all these antenatal visits, both of them, they come together and they take care of each other, like as a heterosexual couple would do. And yeah, so they do have normal families, and they go for it.
Anupama, your view?
So I'm yet to see, after 15 years of being around communities, I'm yet to see a gay couple or a lesbian couple yet. Partly because we've only had a very, very recent repealing of our Section 377. So families were not even a point of focus. Now, how can they go about it? I think one of the ways to go about it might be that it would be a single parent adoption here in India. Single parent IVF fertilization, I'm not aware of the legality. So from the legality standpoint, I'm also not aware whether if a gay couple chooses to adopt a child where one person becomes the father of the child, if it is discovered that they will be, but there were revisions in the adoption rules and there were revisions in the surrogacy laws as well. So I think that's better addressed by a legal standpoint. From the social standpoint of it, we do have a lot of families where there are single parents now. And if single parenthood is fine, then accepting the fact that your parent might have a partner from the same sex is only going to be a part of the upbringing of the child. And so I think it's doable. Have I seen it happen here yet? No, not yet. Would I love to see it? Absolutely.
So, okay, the final point here is that, from a humanitarian point of view, that if same-sex couples want to have a family, it will be ideal to go for an adoption. And because you're doing good to an extended society, extended community. However, scientifically speaking, it is possible to have at least partly your own biology propagating.
Yeah.
In terms, when it's female couples are there, then they can use their ovum with the donor sperm, and the same embryo is implanted in one of the partners. In case of male couples, they can use their sperm and have a donor egg and have a surrogacy as a mode of pregnancy and delivery. So scientifically, all those things are possible now.
Yes.
At the end of it, what is the final take-home message for all the audience? Kaushiki, from you.
That is what the first question was, that why we need to talk about sex objectively, because it is important, it is normal. We need to know what is normal so that we can address the abnormal. So we don't need to talk about the act per se. It need not be the topic of coffee room discussion. But at the same time, if one has any concern, one has any problem, one should not shy away. It is just another system of our body, just like our eyes are, our teeth is. So treat them as that. Don't make it such a hidden thing, such a mysterious thing. There's no mystery about it, scientifically speaking. So this is my take-home message.
Anupama?
So I will boil everything down to communication and non-judgmental communication on top of it. I think whether it's about consent, whether it's about acceptance, whether it's about how to communicate with your partner, whether it's about how do I want to experience sexuality in different frameworks, how do I want to experiment, everything boils down to communication. So please, please, please talk with your folks, talk with your friends, talk with uh, and the more you talk, the more aware you will become of the myths that propagate everywhere, even including our own minds for that matter. The more aware you'll be of your biases. So I think one word advice: communicate.
Okay, great. So, back to the same thing, why I talk about sex, and I would say that never shy away from something which is very, very important. And the message that I want to convey is that society is formed around certain rules and norms which are made for larger good. They're no hard and fast. These may not be natural laws and may not be natural norms, but they're made by a group of people, they're agreed upon by a group of people for the larger good. No? And it is time now to revise those laws in our society, because a large number of people are not sticking to just the conventional sexuality and conventional sex. No? Things are changing, things are evolving. So it is better to include them all. And the conventional sexuality and the conventional way of talking about sex has seen a lot of bad things happening. So it's time for us to change and evolve as a society and change the norms and change our acceptance now. So it's very, very important to start with an open communication, open conversation, and open dialogue at a community level, which was the aim of today's session. Next week, please come back.
Are we taking questions?
Oh, yes. Oh, yes. Sorry. I'm sorry. I jumped.
Okay. Yeah.
So
We have a couple of questions.
So let's have the questions first before we go on to the next week thing.
Okay,
Thanks
so
for
the first question, that's an anonymous. The question was, do adults also need sex education, even if they are sexually active? If they do, how to proceed with that?
I think that's a wonderful question.
What's the resource?
Very, very good question. So I think let me ask Kaushiki first.
Right. If the adult thinks that there are a few questions which are unanswered and they don't have any answer to that, and they would like to seek those answers, then definitely yes, there is no age of learning, whether it is sex, whether it is music, whether it is whatever. So if you think that you need to learn, then go to the right specialist, which can be depending upon what is the gender of the patient. If the person, not the patient, the person, if it's a male, can go to a sexologist or a neurologist or a urologist, or a psychiatrist, while a female can come to the gynecologist. So yes, I mean, there is no age when you stop learning. So why not? If you have a question, why not?
Yeah, so I would say that, when it comes to sex, in adults, there can be difficulties which may be related to a physical difficulty. There can be difficulty or problems related to the psyche. There can be difficulties and problems related to the society.
Compatibility can be an issue.
There's no harm in getting those difficulties, those problems solved and discussing these things and educating yourself. Anupama, what do you say?
I think what I would like to call it, Dr. Manpreet, is in sexual education. There is a lot that needs to be covered, especially because adults have, a lot of adults have children. A lot of adults are in roles of secondary caregivers as uncles and aunts and teachers and whoever else is. So it's always a great idea to stay abreast of what is the latest. Not because you have to agree to it or because you have to refute it, but because it helps you in raising the next generation better. It also helps you in raising, it also helps you in improving your relationship with your partners. So why not? I think sex is, if you are not sexually absolutely inactive and absolutely choose to never be active again, I don't see a reason why everybody cannot go for it. So yeah, by all means.
Manpreet,
Okay.
I would say that this session today is basically a sex education for the adults.
Yeah,
Yeah.
And
yeah,
it does not necessarily mean that to know about it, but how to change the attitudes, how to accept and how to understand the changing practices in the society. So this session is actually meant for the adults. It's not really meant for children. So we did not talk about as if from the point of view for kids, but more from the point of view of the adults. And
yeah.
these I think are very, very important because this needs to come first. Only then we can go on to talking about sex education for children and us too.
Yeah.
Okay. The second question from the audience on this Zoom was, is alternative sexuality actually on the rise, or is it the sharing and awareness of it that's causing it to be more visible?
Anupama?
It's both. So one thing, even when sharing and visibility were not happening, there were communities that were practicing stuff. There were people who were experiencing and experimenting. They weren't really openly talking about it. There was a lot of hush hush about it, but it was existing. The swinging communities, for instance, go back as old as 30 years, 40 years probably even. And again, 40 is not when I was an adult. I was not even born then, but I do hear it down the generations. I do meet people who are now in their 60s and 70s, or probably, yeah, just touching their 80s, who have octogenarian people who have at one point experimented with stuff. Uh, is the exposure bringing it to the surface? Yes. Is the exposure also influencing the younger generation through peer pressure? Maybe. But then again, I think as an adult, as an individual, everybody makes their own choices. I have close friends who got married under the pressure, and once they got divorced is when they got divorced because they discovered their bisexuality after getting married, or they discovered their homosexuality after they got married. So is the expression bringing it out to the surface? Yes. For instance, in the BDSM communities 15 years ago, when I was just a new entrant, there were only 100 people around the country broadly who I knew that they were legit real people and not just some random screen names. Today, on the other hand, I know something like 1,000+ people who are out there, legit there, and are open and expressive about it. So yes, it has changed after 50 Shades of Grey came in. It has changed after the LGBTQ activism happened. It has changed after the feminist movements uh, sort of went on a rise. But is that the only reason? No. I think to bring something to the surface, the thing has to exist first. So it existed, and that is why it came to the surface.
Yeah. Now, see, as a child psychiatrist, this is something that I see. I see 14, 15, 16-year-old kids, and sometimes they are admitted multiple times with the confusion whether I am bisexual, I am pansexual, I am asexual, I am homosexual, what am I? And I think, Kaushiki, one of you mentioned this important point that part
Yeah.
of developmental process is not just to figure out your sexuality, but also other important areas, which, instead of getting stuck with a label and defining your sexual identity, and that's the whole sole goal of your life, you have to gently guide them into other areas too, which needs equal balance in life. There was one last question, and it's an interesting question. So one person, he wants to be anonymous. He's asked, critical aspect of healthy relationship is sexual match between partners. So in Indian society, especially in urban Indian society, how is it possible to check the sexual compatibility of partners before marriage?
So I think it's a very important question that we missed out on in our conversation. That is sexual compatibility important? If it is important, how to find it out before actually getting into a long-term relationship with anybody? So let's start with Anupama.
So, two things here. One, a lot of people say, oh, sexual compatibility is a minor element to a relationship or to a marriage, especially in the arranged marriage scenarios, where areas where, say, tier 2 urban areas or even tier 1, a lot of it, there is this whole thing around sexuality has a function and it needs to perform that function. So the first myth that we want to shatter is that. The second myth that we want to shatter is also that sexuality is restricted to the reproductive age. No, reproductive age is one concept and sexuality is something else. Your sexuality starts before your reproductive age and it continues for years after your reproductive age might be over. So that's when you keep these two things into account, is it important? It automatically becomes important. Now, how to check the compatibility? One of the politically incorrect ways is to simply have a very open conversation about it, saying, hey, you know what, here are my sexual preferences, here are my hard limits. But this is something where you will have to do a lot of self work before you get into that conversation. So you will need to know what are your absolute non negotiables. For instance, if I am someone who is absolutely monogamous, who will absolutely not tolerate even the presence of a friend who's more than a friend, then I have to state it upfront. On the other hand, if I'm a polyamorous person, then I can't lead someone into a monogamous marriage with me when they don't know that I'm poly. So conversations like those will need a lot of self-awareness, but that is one way of doing it. The second way of doing it in a generally assumed situation where you know that you are a monogamous person who wants to settle down with another monogamous person. A good way to start is like Dr. Kaushiki said, last 5 years, the change has been seen. And there are people who go for the premarital counseling. There are people who get their HIVs, HPVs, STIs tested, their profiling done. That's a good way to start. That's a very non-threatening, non-intrusive way to start. The other ways to start, of course, could be, okay, here are my reading preferences, here are my watching preferences, here are my sexual preferences. Make it a part of a larger conversation and then it becomes less intimidating. So those are some ways. Tell your parents what you want. It's going to be the trickiest part, it's going to be the toughest part, but you will have to put your foot down. Love marriages are, of course, an easier way out because you get to explore with your partner in a love marriage situation. I'm assuming that people explore before they settle down with someone. So if that is taken into account, then that also can be a way.
Kaushiki?
Okay, fine. So there is no trial or run or way of figuring out that whether one is compatible or one is not compatible. It is only once you are in a relationship then that you would come to know that how important the sex is between two partners, or how frequently one wants to have, what kind of sex one wants to have, because it has been found again in studies that the behavior pre-marriage between couple that might change, because sexuality is something which keeps on changing throughout the life. So a partner who might be behaving very differently just before marriage might change post-marriage, and then a sizzling chemistry which was there before, then it might be just a dead post-marriage. So but the good thing is that compatibility is something on which one can work. It is acquired. It is something on which the couple can work together, which would mean that one needs to be more charitable, more empathetic, more sacrificing, because you are considering not just your own needs, but you are taking in consideration the needs of the other, of your partner. And that way you can work on marriage to make it more compatible. But say, for example, if there is one of the partner would like to have oral sex, while the other one is totally averse to the idea of having oral sex, and it will never materialize, and that can lead to a great problem in later life. So basically there is no such 100% foolproof way of knowing whether a couple is compatible or not, but one needs to work on that, and it is very much doable. That is what science is.
So two important points which came out. One, Anupama pointed out that the concept or idea of premarital counseling, With last week when we had a chat on marriage, there the psychiatrist Dr. Sanjay Chuk also had pointed out that premarital counseling has not been happening, but something that should happen. So I would say that yes, if one should go for premarital counseling through a psychiatrist, and that is where one could actually address these issues. They can put these issues across to the psychiatrist who can verify it with the other partner also. And then Kaushiki said that the sexual behavior is not a static thing. It actually changes over a period of time. It evolves, and it is very well known fact in the society that things change. The initial chemistry changes, all when the thrill is gone, things change a lot, So, but by premarital counseling with the psychiatrist or with the counselor, at least these sexual conflicts or conflicting sexual behaviors or aspirations can be avoided. Whether compatibility will emerge or not emerge, that's a matter of time. But at least the negative situations where the two people have got a conflicting aspirations about sex, that can be avoided.
I think one of the common things that all three of us are saying is about figuring out what is the non-negotiable and being able to vocalize it.
Yeah.
And an ongoing communication, because there will be things like pregnancy, there will be things like postpartum depression, there will be things like work and money and everything else taking it up. So in a larger span of say a 50-year relationship with your spouse or your partner, you don't want to stay where you were when you were 23. At 60, you want to be a different sort of a partner. At 23, you want to be a different sort of a partner. So that ongoing communication and ongoing consent is we want to talk of. Yeah, I agree. Premarital photo shoots are so not a great idea, Manpreet.
So, Manpreet, any more questions left?
No, that's it. These are all the questions. Yeah, we covered all.
So great.
I'd like to ask one thing.
Yeah.
Especially for some of the younger people or parents of younger people, there are certain practices which as grown-ups or hopefully educated adults, we would know are inherently unsafe. And you did point out safety, consent, and a third thing also.
Sanity.
Yeah, sanity. So sanity, I think, as far as sex is concerned, sanity is the last thing that would be on people's mind when they are in the frenzy of it. So these inherently unsafe practices need to be actually put on the table. And the youngsters especially need to be aware not just about physical safety, but also emotional and psychological outfall of unsafe practices. And just because we are being politically correct, not naming them and accepting them as somebody's choice. When you put something out as a psychologist, Anupama, you would understand that when we are measuring some behaviors, we are actually encouraging them also.
So here is how I look at it, Dr. Nidhi. One thing that I want to put out here is choice for choice's sake is not something that I endorse. For instance, age difference. It's a major point of contention when you look at it. Like Kaushiki pointed out, a 15-year-old going out with a 25-year-old could actually be a case of abuse. And at the same time, a 20-year-old going out with a, say, 35-year-old could actually well be a legit choice. Now, what is important, and which is why I think the younger generation is actually not doing a bad job at it, is because they know that there are things that will happen. They know that there are things that they will have to experiment with. Now here is where I think if you like, I'm not trying to be politically correct or incorrect. I'm simply trying to, so when I said no substance abuse, now why not substance? Because it's easy to say under the influence of a substance, oh, my boss is so hot, and it's easy for your boss to probably take advantage of you, or for you to give in to his advances when you might later feel like I did not want to do that. Which is why, like Dr. Dhawan pointed out, a yes has to be a well-calculated yes. And the age differences and the influences and peer pressures and all these things will influence the unsafe. And for unsafe practices, I think also what needs to be done is a lot of work in terms of the medical fraternity, the social science fraternity. And we need to sit down together. Now, what is happening, the way I see it happening, is that there are very few people talking in a very holistic sense of it. So for instance, as a social scientist, I do not get to hear much from the medical fraternity on it. I do get to hear from the psychologists and psychiatrists a little bit of it, but I don't get to hear it or probably from an obs gynae person, but I don't get to hear about it from, say, a neurophysician. What do they feel about it? Or from, say, an orthopedician, what do they advise in terms of impact play? Because those conversations are not happening. So you're right, it needs to be put out there, but to be able to put it out clearly and in a non-confusing manner. We need to bring these things onto panels and talk about them from a very holistic perspective. And only then will we be able to accurately say that this needs to be done. So I'm not in contention with you. I'm only agreeing with you, and I'm simply adding to it that there's a lot of work that needs to go into it.
So we overshot the time by a big margin today. So
Sharad had one question, if we have time for one
sure,
more.
sure. Why not? Why not?
Sharad, let's unmute him. Okay.
I think he texted me on Facebook saying he got
Okay.
disconnected. There is
Okay.
a question in the chat.
Hello.
Yes,
Oh,
Sharad.
yeah. Can I ask the question?
Go ahead.
Yes.
Yeah. I was just wondering that sometimes you see with time the sexual needs, the conflicting sexual needs change with time in a relationship. So, despite premarital counseling, that will not help. So how one has to be, the partners have to get used to that. Is there any suggestion from you?
Let me answer that. See, the premarital counseling will basically rule out the gross incompatibilities which are present at that point of time. How it cannot predict anything about the future, but yes, it can always say that whether the people are going into a relationship with the right attitude, with the right approach. No, are they likely to work on the differences which may emerge in future? Are they capable of dealing with the challenges which they may face in their future life? So that premarital counsel can reflect upon. But yes, in any marriage, every marriage is a lot of risk involved. It's a gamble.
Yeah.
And there's no way to make sure that what is going to happen in future. But if two people are coming into a relationship where they know they're going to work hard together to keep it going, then things will be fine. They'll be able to overcome the differences. They'll be able to overcome the conflicts and challenges which may arise in future.
But Dr. Sanjay, sometimes what happens that the premarital counseling happens very early in age when people are probably not mature enough. So maybe they are not open to discussion.
So I think, see, the premarital counseling which I'm talking about is that, when, say, somebody is deciding to get married to somebody, say X wants to get married to Y, then X and Y should separately or together go to a premarital counselor for counseling individually and together. So to assess that whether they are, really the right people for each other or not, with an open eye, with an open mind.
Yeah, I think that is very, very important that premarital counseling should happen with a proper person.
I'll only add one.
Psychologist.
I'll add one thing, Shavit, to answer your question. Premarital counseling is one framework. Like we discussed, it's a 50-year relationship that you're creating. Things will change. You will have to be open to communicating with each other, like Dr. Dhawan pointed out. And you always have the option of going for a marital counseling. Like, why do we have to restrict it just to premarital or just to divorce counseling? Like, there's a lot of spectrum in between. So an ongoing counseling and an ongoing discussion and an ongoing communication and frameworks that you can create always work better than just one phase of it.
Thank you.
So that brings us to the end of today's session. And next week is another very, very important subject, childhood learning disorders, the developmental differences and the conditions that affect learning in children. On 6th of September, that is next Sunday, 11:30 a.m., same time on the live chat. Do tune in, do come back. It's a very, very important subject, and I'm sure that a lot of us have themselves experienced difficulties or have had somebody close to them who had these difficulties. So it's a very, very important subject that we should all be discussing and talking about. And don't forget to join our Facebook group, the live chat. I'll take this opportunity now to thank our experts, Dr. Kaushiki and Anupama. Thank you very much for coming on this show, for sharing all the information with us. And thanks, Dr. Manpreet, for being the back-end support in place of Anupama today. You played her role today. And
thank you.
Thanks the audience for participating, for the questions you asked. Thanks, Shara. Thanks, Nidhi. And thanks the anonymous people who asked the questions. I'm looking forward to seeing you all the next Sunday. Till then, bye-bye. Have a great week ahead.